It is the Omicron effect. The Stevenage Vaccination Centre was doing a roaring trade today. Across England yesterday, 390,000 boosters were booked as the over-30s joined the list of those eligible. It is far short of the Prime Minister's target of 1 million a day, but that's partly because those in charge of the jabs were unprepared for the announcement.
So the target at the moment is that we will have offered a booster dose or a booster appointment to everybody by the end of December. That is an extremely difficult target, I think, for any of us to reach. It really is a big change to where we were planning to begin with. So we're working with our colleagues across the system and obviously in the region to see how we can increase our capacity. Not everybody will have been able to have got a booster by the end of December, but it's that offer that we will do.
And even as they were jabbing here, the UK's 4 chief medical officers recommended that the 15-minute wait after a Pfizer or Moderna vaccine should be temporarily suspended to allow more people through the system. From today, those double-jabbed will be asked to take a lateral flow test every day for 7 days after contact with somebody with COVID-19, should they be able to order an LFT. The government website's still reporting they were unavailable. And there was a short supply too of PCR appointments because of high demand.
Yeah, the president said we must get vaccinated before travelling, so it is a must.
In South Africa, the latest data once again appeared to show cases of Omicron were mild and that intensive care units were still not overwhelmed. And preliminary numbers also suggest that those vaccinated with the Pfizer jab are 70% less likely to be admitted to hospital than those unvaccinated. Here in the UK, though, scientists across the border urging caution, warning that it is far too early to know the impact of Omicron. It is only 3 weeks since the variant was identified. Members of the Science and Technology Committee today were left in no doubts.
We do not have enough individuals in hospital in this country to be able to give an understanding of severity. We would hope that the vaccine high uptake that we have will make the severity of this less than we've seen in previous waves that we've had. But we are concerned with the large volume of individuals who are being infected every day in the population, that we are going to have a very difficult 4 weeks ahead with cases in the community, which will of course cause individuals to need to stay off work and school, and then for those cases to transfer into admissions to hospital.
And there was a warning too that if Omicron modelling so far is correct, then the country will need some level of restrictions in place for the next 4 to 8 weeks.